experience stomach cramps before a big meeting or a loose stomach when life gets hectic? Many people notice a direct connection between stress and digestive issues. In this video, we'll explore this complex relationship and give you some practical tools to manage it. Let's dive in. Our stomach, often called the second brain, is tightly connected to the nervous system. When we experience stress, our body activates the fight or flight response, which can disrupt the normal digestive process. This disruption can manifest in several uncomfortable ways. Stress affects digestion in several ways. It can reduce blood flow to your stomach and intestines, hindering optimal function. It also alters your gut flora, which is critical for healthy digestion. Finally, when stressed, the release of hormones such as cortisol and adrenaline directly impacts the digestive system, causing a cascade of issues. The most common and uncomfortable symptoms of stressed stomach include abdominal pain and cramps, bloating and gas, diarrhea or constipation, and even nausea. If you experience these symptoms regularly, especially during times of high stress, it's important to address both the physical and psychological aspects of the problem. Irritable bowel syndrome, or IBS, is a common functional gastrointestinal disorder. Studies have demonstrated a clear link between stress and the worsening of IBS symptoms. Stress can trigger or amplify IBS, and conversely, the stomach problems themselves can lead to increased stress and anxiety. For many, it becomes a self-reinforcing cycle. Diet plays a central role in managing stressed stomach. While there is no one-size-fits-all solution, some general guidelines can be helpful. First, eat regular meals and don't skip any meals. Also, avoid processed foods that often contain high amounts of sugar, fat, and additives. Furthermore, limit your caffeine and alcohol intake and make sure to drink enough water every day. It's also important to identify your individual trigger foods. Keep a food diary to track any symptoms you may experience after eating certain foods. Common triggers include gluten, lactose, fructose, and even artificial sweeteners. Remember that individual responses may vary, so listen to your body. You might want to consider a low FODMAP diet. This diet limits the intake of certain carbohydrates that can ferment in the gut and cause discomfort. The diet could reduce gas, bloating, and other digestive symptoms. However, it's important to consult with a registered dietitian or nutritionist before starting a low FODMAP diet to ensure that you are getting all the necessary nutrients. In addition to diet, several lifestyle changes can help reduce stress and ease digestive issues. Regular exercise is a great way to relieve stress. Prioritize quality sleep, establish a regular sleep schedule, and practice mindfulness and meditation techniques. Finally, seek support from friends, family, or a professional therapist when needed. Irritable bowel syndrome affects approximately 10 to 15% of adults worldwide, which is a significant portion of the population. Stress is a known trigger and can exacerbate symptoms, which is why managing it is so important. Diet and lifestyle choices can also make a big difference. If you're struggling, don't suffer in silence. Seeking help from a healthcare professional or support group can make a big difference. So, remember that managing stress through diet and lifestyle changes, identifying and avoiding trigger foods, and prioritising sleep and exercise can significantly improve your gut health. For personalised support in managing stress, consider downloading Harmoni for a free 14-day trial. You can find the link in the description below. Thanks for watching.